Blood clots, the silent killer. Behind most heart attacks and strokes. For decades, we have been warned that cholesterol, plaque, and calcium buildup in the arterial walls are the main causes of heart attacks and strokes. However, recent discoveries have pointed to the real culprit behind most heart attacks and strokes: blood clots, or clots. A little discussed, but highly dangerous factor. A blood clot is a natural part of the body's mechanism to stop bleeding when blood vessels are injured. However, the serious problem arises when a blood clot forms at the wrong time in the wrong place, particularly in coronary arteries or brain blood vessels. What's frightening is that a blood clot can form in less than 5 seconds and immediately block the blood flow, causing a sudden lack of oxygen to the heart or brain. This is why heart attacks and strokes often occur very quickly and unexpectedly, leaving the victim no time to react. Contrary to popular belief, cholesterol, plaques, or calcium tend to accumulate slowly and are not enough to completely block blood vessels in a short amount of time. Many people can live for decades with plaques without any serious issues. The problem only arises when the plaque ruptures, damaging the vessel wall, prompting the body to form a large blood clot. And this blood clot is the last straw that leads to a stroke or heart attack. Therefore, to effectively prevent cardiovascular diseases, it is essential not only to control cholesterol, but also to reduce the risk of blood clot formation by managing inflammation, stress, blood sugar levels, lifestyle, and exposure to toxins, such as tobacco, smoke pollution, and synthetic hormones. Blood clots are not the enemy if they work in the right place and at the right time. But when the body mistakenly targets the wrong enemy, life can be threatened in an instant. Blood clots are not the root cause. The root cause is artery wall damage. For a long time, blood clots have been considered the primary cause of heart attacks and strokes. However, in reality, blood clots are just the body's natural response to vascular damage. It's like when you cut your hand, your body immediately forms a clot to seal the wound, and the blood vessels inside react similarly when the artery walls are damaged. This means that blood clots are not the root cause, but rather the damage to the artery walls is the culprit behind the scenes. These damages make the arterial walls rough, easy to tear, and prone to cracking, creating an environment for a blood clot to form, sometimes in less than 5 seconds, to patch the tear. But if the blood clot is large enough and forms in a critical spot, it will block the blood flow to the heart or brain, causing a heart attack or stroke. So what causes damage to the artery walls? It's not just cholesterol. Many harmful factors that we rarely consider, such as cigarette smoke and environmental toxins, which cause chronic inflammation in the vessel walls, high blood sugar levels, which make the blood stickier and attack the vessel walls, stress and synthetic hormones, such as birth control pills, which disrupt the body's balance and increase the risk of vascular inflammation. Excessive calcium, especially in postmenopausal women, which can accumulate in the vessel walls and create an environment for clot formation. Rather than focusing only on lowering blood fats, we should care about keeping the vessel walls healthy, flexible, and undamaged. This can be achieved through a healthy lifestyle, not smoking, limiting refined sugars, getting enough sleep, reducing stress, eating plenty of greens, antioxidants, and anti-inflammatory foods. In conclusion, blood clots are not the enemy. They are the body's SOS signal. If you take care of your vessel walls properly, the body won't need to patch up mistakes by creating dangerous, life-threatening clots. Key warnings from within: silent factors. Triggering blood clots. Blood clots or clots are the leading cause of dangerous strokes and heart attacks. The frightening part is not that the body forms clots, but how and when they appear. Under ideal conditions, clots are biological bandages that help the body stop bleeding and heal vascular damage. However, when a blood clot forms at the wrong time, in the wrong place, it can block blood flow, leading to serious consequences within seconds. So what triggers this misfiring clotting mechanism? Below are the dangerous but often overlooked triggers. 1. Tobacco smoke. The arsonist of blood vessels. Both traditional cigarettes and electronic cigarettes, vapes, contain hundreds of harmful compounds. When inhaled, these substances inflame blood vessel walls, thinning and damaging the endothelium, the layer that determines vascular elasticity and health. The body perceives this as an injury and immediately triggers blood clotting mechanisms. The result, unnecessary clot formation, which can become dangerous. Serotonin alcohol, a liver toxin, a burden on blood vessels. When alcohol is consumed, the liver must work continuously to detoxify it. However, once the alcohol level exceeds a certain threshold, toxins spill into the bloodstream, causing inflammation in tissues and vessel walls. Chronic inflammation not only weakens the vessels, but also promotes clot formation and growth. Regular alcohol consumption, even in moderate doses, carries significant cardiovascular risks. E3. Birth control pills and hormone therapy, disrupting clotting balance. Estrogen, the primary hormone in birth control and hormone therapy, can increase blood clotting. In some individuals, particularly women with a genetic predisposition to clotting disorders, using estrogen-containing products significantly raises the risk of stroke and heart attack, especially when combined with smoking or a sedentary lifestyle. 4. Stress, the broken heart syndrome. Few realize that emotional shocks like grief or loss can literally break the heart. Known as broken heart syndrome, this condition involves a type of cardiomyopathy triggered by extreme stress, which can raise heart attack risk by up to 2,000%. Chronic stress also raises cortisol levels, promotes inflammation, increases blood stickiness, and activates clot formation. Number 5. Surgery and endurance sports, extreme physiological stress. Major surgery or high-intensity endurance sports like marathons place tremendous strain on the circulatory system. When the body's in recovery mode or pushed beyond its limits, clotting processes can become overactive. This is why post-operative patients and endurance athletes are carefully monitored for blood clot risks. 6. Refined carbs and sugar, a fuse for vascular inflammation. A diet rich in sugar, white flour, and processed foods is a root cause of chronic vascular inflammation. Sugar makes the blood more sticky, encouraging platelet clumping and clot formation. This is also why people with diabetes have a 4 or 5 times higher risk of stroke compared to the general population. 7. Chronic infections, from oral health to heart health. An infected tooth or chronic sinusitis can act as a hidden bacterial reservoir, leaking pathogens into the bloodstream daily. The body responds to these invaders by increasing clotting activity as a defense mechanism. Chronic infections also elevate vascular inflammation, laying the groundwork for clot formation. 8. Excess calcium, bone booster, vascular hazard. Postmenopausal women are often advised to supplement calcium to prevent osteoporosis. However, excess calcium that isn't absorbed can deposit in blood vessels, especially in the absence of vitamin K2. Since calcium plays a role in over 15 clotting factors, high levels can increase the risk of clot development. Conclusion, blood clots are a natural survival mechanism, but when triggered improperly, they become a threat. The key lies in preventing vascular damage and keeping the circulatory system stable. By avoiding these risk factors, eating a healthy diet, managing stress, getting adequate sleep, and maintaining a scientific lifestyle. That is the most effective way to protect the heart and brain from the sudden danger of a blood clot. Substances that help effectively prevent blood clots. To protect cardiovascular health and reduce the risk of blood clot formation, there are several key nutrients and factors that can support the body in maintaining clear blood vessels. Below are the prominent substances and factors that help prevent blood clots. 1. Vitamin K2 prevents calcium buildup in arteries. Vitamin K2 plays an important role in preventing calcium buildup in soft tissues and arteries. Calcium can accumulate not only in bones, but also in blood vessels, leading to calcification and increasing the risk of blood clots. Vitamin K2 helps direct calcium to the right places, maintaining balance and protecting arteries from stiffness, which in turn reduces the risk of blood clots. Sources of vitamin K2: vegetable oils, cheese, butter, and fermented dairy products. 2. Vitamin D, powerful anti-inflammatory in arteries. Vitamin D not only helps the body absorb calcium, but also plays a strong role in reducing inflammation in the arteries. Inflammation in the arteries is a factor that triggers blood clot formation. Vitamin D helps reduce inflammation, protect blood vessels, and support the immune system. A deficiency in vitamin D can increase the risk of cardiovascular diseases and strokes. Sources of vitamin D: sunlight, the main source. Fatty fish, such as salmon, cod, liver oil, and vitamin D supplements. 3. Magnesium regulates calcium and prevents arrhythmia. Magnesium is an essential mineral that helps regulate calcium levels in the body while also preventing arrhythmias, a condition that can lead to abnormal clotting. When magnesium levels are low, the risk of heart rhythm problems and blood clots increases. Magnesium also helps relax blood vessels and reduce the risk of blood clots. Sources of magnesium: seeds, nuts, leafy greens, and legumes. 4. Nitric oxide, NO, helps dilate blood vessels and reduce clotting. Nitric oxide, NO, is an important compound in the body that helps dilate blood vessels, allowing blood to flow more easily and reducing clotting. NO supports improved vascular function, reduces inflammation, and lowers blood clot formation. Some factors that can help increase nitric oxide levels in the body include sunlight, foods rich in arginine, and certain vitamins and minerals. Increase nitric oxide by sunlight. Sunlight stimulates the body to produce nitric oxide naturally. Foods rich in arginine. Arginine is an amino acid that stimulates nitric oxide production. Rich sources of arginine include meat, liver, and nuts. Vitamin D and polyphenol-rich foods. Foods rich in polyphenols such as grapes, berries, and green tea help stimulate nitric oxide production and reduce the risk of blood clots. Conclusion: a scientific diet that includes important nutrients such as vitamin K2, vitamin D, magnesium, and nitric oxide can help protect cardiovascular health, reduce the risk of blood clot formation, and promote long-term health. In addition to maintaining a nutrient-rich diet, regular exercise, stress management, and controlling lifestyle factors also play an essential role in protecting the circulatory system. Termites, habits and foods to help reduce the risk of blood clots. To reduce the risk of blood clot formation, in addition to supplementing with important nutrients like vitamins and minerals, certain healthy habits and natural foods can play a significant role in protecting cardiovascular health. Below are beneficial habits and foods to help reduce the risk of clotting. 1. Fasting reduces inflammation and prevents clotting. Fasting has been studied and proven to be an effective method for reducing inflammation and protecting cardiovascular health. Fasting helps lower blood sugar levels, reduces inflammation in the body, and may decrease the risk of blood clot formation. This process helps the body regenerate cells, improve blood circulation, and reduce inflammatory factors related to clotting. Chapter 2. Ketogenic low-carb diet reduces inflammation in arteries. A ketogenic diet, or a low-carb diet, has been shown to reduce inflammation in the arteries. When the body shifts from using carbohydrates to fats as its primary energy source, it reduces blood sugar levels and decreases inflammatory factors. Inflammation in the blood vessels is one of the triggers for clotting, so this diet helps reduce the risk of blood clots and improves cardiovascular health. 3. Regular exercise without overexertion. Regular exercise without overexertion is an important habit to maintain good blood circulation and reduce the risk of blood clots. Exercise helps lower blood pressure, improves heart function, and reduces inflammation in the body, thereby reducing the risk of clot formation. However, it's important not to overdo it, as excessive exercise can put stress on the body and create conditions for clot formation. Number 4. Garlic and onion, natural blood thinners. Garlic and onion are natural foods with powerful blood-thinning properties. Garlic in particular is well known for its ability to naturally thin the blood and improve circulation. It contains a lysine, a compound that can reduce the clumping of blood cells and lower the risk of blood clots. Onions also contain similar compounds that support heart function and reduce the risk of strokes and heart attacks. Number 5. Vitamin C and omega-3 help thin the blood naturally. Vitamin C and omega-3 are two important nutrients that help protect cardiovascular health and naturally thin the blood. Vitamin C has antioxidant properties that help protect the vessel walls from damage and inflammation, reducing the risk of clot formation. Omega-3, particularly DHA and EPA, helps reduce platelet aggregation in the blood, making it easier for blood to flow and lowering the risk of blood clots. Sources of vitamin C: berries, strawberries, blueberries, oranges, guavas, broccoli. Sources of omega-3: salmon, sardines, chia seeds, flax seeds. Conclusion: to reduce the risk of blood clot formation and protect cardiovascular health, maintain a healthy lifestyle with habits like fasting, regular exercise, and adopting a ketogenic or low-carb diet. Additionally, incorporating foods like garlic, onion, and omega-3 will help thin the blood and reduce inflammation. Always maintain a scientifically balanced diet and exercise routine to maintain optimal heart health. Some natural enzymes that support blood clot reduction. In addition to healthy habits and nutrient-rich foods, some natural enzymes can effectively support the reduction of blood clots. These enzymes work powerfully in the body to help break down blood clots, reducing the risk of serious cardiovascular issues like stroke and heart attack. However, they should only be used when there is a specific clotting issue and when used properly. 1. Nattokinase. Nattokinase is a natural enzyme extracted from fermented soybeans, natto, a traditional Japanese dish. This enzyme is notable for its ability to break down blood clots by degrading fibrin, a protein in the blood that helps form clots. Nattokinase has a blood-thinning effect and reduces the risk of blood clot formation in the body. This enzyme is considered a safe and natural therapy for supporting heart health. How to use nattokinase should be taken on an empty stomach to optimize absorption and effectiveness. However, it's essential to consult a doctor before using it, especially if you are on blood-thinning medication or have blood pressure issues. Q2. Serrapeptase. Serrapeptase is a protease enzyme extracted from the bacteria Serratia E15, which is found in the digestive system of silkworms. This enzyme has the ability to break down proteins, including fibrin, helping to reduce blood clot formation. Serrapeptase also has anti-inflammatory effects, supports the removal of impurities from blood vessels, and improves blood circulation. It can also help reduce pain and swelling, especially in vascular inflammation conditions. How to use like nattokinase. Serrapeptase should be taken on an empty stomach for optimal results. However, its use should be monitored by a doctor, particularly for those at risk of bleeding or who are on blood-thinning medications. 3. Bromelain. Bromelain is a natural enzyme found in pineapples, particularly in the core, and stem. Bromelain has the ability to help break down fibrin, thereby reducing blood clot formation and improving blood circulation. In addition to its blood-thinning effects, bromelain has anti-inflammatory properties and supports digestion, relieving symptoms of arthritis and aiding in faster recovery from injuries. How to use bromelain should also be taken on an empty stomach to maximize absorption. As with the other enzymes, if you are on blood-thinning medication or have blood pressure issues, consult your doctor before using bromelain. Then important notes when using natural enzymes. Correct dosage. It's essential to follow the correct dosage and instructions from a doctor or nutritionist when using natural enzymes. Taking excessive amounts can cause side effects and may not provide health benefits. On an empty stomach. To achieve maximum effectiveness, natural enzymes should be taken on an empty stomach, as this allows the body to absorb and utilize them most effectively. Consult a doctor before adding any enzyme to your diet. Consult your doctor, especially if you are taking other medications or have a history of clotting disorders. Conclusion. Nattokinase, serrapeptase, and bromelain are natural enzymes that can support the reduction of blood clot risks and protect cardiovascular health. However, their use must be done correctly and only when there are clotting issues. Be sure to consult your doctor before adding these enzymes to your healthcare routine to ensure safety and effectiveness.